If there is one question that I get asked all the time, it is, how do I get clients in my medical billing business? How do I get my first client in my medical billing business? Now, I did a video in the past, I'll link that above, that talked about 5 ways to get clients in your medical billing business. And you can watch that after you watch this one. I am telling you in this video practical things that if you do them should work for you to at least get your first medical billing client. Now, these are some things that people don't usually talk about because everybody believes that, oh, if you put out ads or Facebook post or, have a nice website, that you will get clients. And I'm not saying that you can't get clients that way, because there are many ways to get clients. What I am saying is that there are some things that you have to do within yourself to help you get that first medical billing client. And it has nothing to do with all of that outside noise that you think is going to help you. So one of the first things that you should do to land your first medical billing client is to know who you are speaking to. Know your target client. Who is the person that you want to work with? Now, you might say, as a new medical billing business owner, that I want to work with anybody. Anybody who is going to let me do their billing, I'll do their billing. Now, that could be true for you, but I would not recommend that. Because when you talk to everybody or you take on everybody, then you don't do as good of a job. You should specifically be talking to certain people. Now, that can be you're talking to private practices, or you're talking to mental health providers, or you're talking to hospitals. You are targeting a specific set of people, so you talk specifically to them. If you're talking to everybody, you're not really going to know what to say. Your messaging, whether you do ads or radio ads or you put something in a newspaper, your messaging is going to be all over the place and no one's really going to know who you're talking to. So although you think you may be able to get a provider because now you're talking to all the providers and you know that there are many providers out there, but no one is resonating with you because you're really not talking to anybody. You're talking in the air and they want somebody who's going to specifically talk to them. You'll also be able to engage specifically with that community. So for instance, if you are targeting private practices who deal with OBGYN, you'll be able to go specifically to networking meetings that deal with OBGYN providers. There you'll be able to find the specific audience that you're working with. Maybe that is your specialty, so you know more specifically about that specialty. And you will be easier to get a client that way because now they see that you're speaking specifically to them and you know what their issue is. And that brings me into the second way to get your first client. And that is to show them the benefit of using your services. I know you've probably heard that one a lot, and you probably say, well, I'm a biller, like I do billing things. But although that is true, you need to show them how your billing services can help them. So like I said, let's use the example of the OBGYN specialist. If you are targeting OBGYNs, you can show them how you have solutions specifically for their specialty. Maybe they have a problem with getting paid for deliveries. And because you know specifically about OBGYN billing, you can tell them what you would be able to do in order to get them paid and get them paid on time. You can also highlight to them how you can decrease certain things for them. Whether that is time or money or stress, you can help them in some way, some form or fashion. So you want to show them the benefits. And one thing that you don't want to do is only talk about yourself. Talking about yourself does not show them what you can do for them. When you're showing them how you can benefit them, it is all about them. You want to tell them all the things that you can do for them to make their jobs easier, to increase their revenues, and be specific. You don't want to give these general, oh, I can increase your revenue by 10, 15, 20%. How do you even know that if you have no data to back that up? If you don't even know if they're having a problem with that. So you want to dig in deeper and you want to be able to talk to them and show them how you are the right one for the job. And this is whether or not you have a lot of experience or a little bit of experience. They just want to know that they have someone in their corner that is going to fight for them to get them paid for the services that they provide to their patients. So if you have questions about trying to hone down on who you want to bill for, who you want to target, make sure you schedule your remote one-on-one with me today. I have 45 minutes and 90-minute sessions, and I can help you decide on whether or not you want to bill for private practice, bill for OBGYN. Who do you want to target so you won't feel so overwhelmed with the fact that there are so many providers out there, but no one wants to hire you. Spaces are limited. I will put the link below, so make sure you schedule your remote one-on-one today. And then there is to build a trust factor. And this for me is the most important, because even when I wasn't able to show the provider how I can benefit them, or I didn't even really know who I was speaking to, I just know that I needed a provider. When I had that trust factor involved, I had people coming to me. I had providers asking me to do their billing. I didn't even have to go out there and ask them to do the billing. And let me read the definition of trust. Trust is the firm belief in the reliability, the truth, ability, or strength of someone or something. That is an important thing to have, because a provider is not just going to give you their billing to do, and they don't have that trust factor with you. Now, trust doesn't necessarily equal up to how long they know you, if they know you. There's something that has to be there in order for them to have some form of trust in you. That can be you showing them your knowledge. Now, you can show them your knowledge by helping them for free with something. You may be at a networking event, you may be on Facebook and someone has a question and you just answer that question. You answer the question, you give them everything that they need to know, so when they apply it and they see that it works, they come back to you and say, oh well, he knows what he's doing, she knows what she's doing, and I want them to do that for me. So you can show them that you know what you're doing without trying to sell them your services, because now your knowledge speaks for itself. Giving valuable content and tips to providers, whether that is local in your area or if you're trying to target providers that are, in different states as you can just give them free knowledge, and it's not about keeping it all to yourself. Again, if you can help them, they might now know what it is to do, but they might say, well, I don't know how to do this. And then they want to ask you how to do it. Or they might not even want to do it. They may now know how to do it, but they don't want to do it. Because providers are not billers. Providers are trying to help their patients and deal with the clinical side for their patients, not the billing side or the administrative side. And then you may have worked with other people who know you, who trust you, who knows your work and that you're reliable. They can also recommend your services to a provider. So you might not be the one that the provider actually knows or is even talking to, but someone that you know may know the provider and get you that first client. And then there is listening and communicating with the provider. So if there's one thing that a provider doesn't like, it's for you to not hear what they're saying. If all you're doing is talking about what you can do and what you have and all of that stuff, but not listening to what they want and what they need, that can be a complete turnoff. So make sure when you're talking to a provider, you are listening to what they're saying and what their problems and issues are, and then you are communicating to them clear and precise about how you can fix that problem. You will get that first client in a heartbeat if you heard them say that they have problems posting payments, and then you said, well, I can post your payments within an hour by using this system and using this technique. So if you want your first client, make sure that you do these 3 things in order to get one. And I'm sure that you'll get your first client before you know it. So if you like this video, then you'll love this video that is talking to you about ways to reasonably decide how many clients you can take on. I'll see you again in my next one.